Hello, everyone, and welcome to our joint continuing education webinar between CareQuest Institute for Oral Health, the Association of State and Territorial Dental Directors, and the National Association of School Nurses. My name is Vu Deep, and I am the health science specialist here at the CareQuest Institute for Oral Health. Our webinar topic for today is on the challenges in implementing school-based oral health programs, short and long-term impact of COVID. Next slide, please. Before we start, I would like to go over some housekeeping items. All lines will remain muted to avoid background noise. We will also share a copy of the slides and a link to the recording after the webinar takes place. And it will also be listed on our website at carequest.org. In order to receive one ADA CERB Continuing Education Dental Credit, you will need to fill out the evaluation form, which will be shared with you at the very end of the presentation. And it must be completed by end of the day, Friday, May 21st. In order to receive one continuing education nursing credits, please visit the NASN website for more information. At the end of the presentations, we hope to have time for a Q&A session. We are not going to take any questions in between presentations, and we will be monitoring the Zoom Q&A box throughout the entire presentation, and we will do our best to answer all your questions at the very end. By the end of this webinar, we hope that you will be able to describe the impact of COVID-19 on state and oral health programs' ability and implement school-based oral health programs, identify successful strategies and barriers faced by school-based oral health programs, and understand the long-term impact on the oral health of children. Also understand how NASN can support the dissemination and reach oral health programming resources to school nurses. And lastly, recognize at least 3 methods to support school nurses in returning to school and planning for oral health program. Now I will turn it over to Dr. Julie Hawley to get us started.
Thanks, Sue. So I'd like to introduce our speakers today. We'll be hearing first from Lori Kepler-Cafano. She is a registered dental hygienist and serves as a consultant to several of the Association of State and Territorial Dental Directors committees, including the Best Practices Committee, the Health and Aging Committee, the School and Adolescent Oral Health Committee, and the Peer Support Program. She serves as a facilitator on numerous projects related to school-based dental sealant programs. Lori is the President Emeritus of the Board of Directors for Future Smiles, and which is a school-based prevention program in Las Vegas, Nevada. She resides outside of Austin, Texas, and is a member of the Texas Oral Health Coalition. Her professional experience encompasses over 35 years in oral health, including more than 10 years in Nevada's State Oral Health Program. Prior to that, she served 17 years as a clinical practice dental hygienist. We'll also hear from Tamana Tawari, who is a dentist and assistant professor in the Department of Community Dentistry and Population Health, and is the Associate Director of the Center for Oral Health Disease Prevention and Population Health Research at the School of Dental Medicine at the University of Colorado. Dr. Tawari's research areas are oral health disparities, community-based participatory research, and behavioral research and oral health policy. Dr. Tawari is funded by the National Institutes of Dental and Craniofacial Research and the state and national foundations to conduct research to reduce oral health inequalities. She has published several peer-reviewed publications and has presented her research at several national and international conferences. She's leading various national and international volunteer positions within public health and research organizations. And we'll also hear from Liz Clark. Liz is a registered nurse and has over 25 years of experience as a school nurse and in school health services administration. She implemented oral health programs in 3 school districts in Colorado, working with federally qualified health centers, dental hygienists, and community dental nonprofit organizations. She is currently employed by the National Association of School Nurses as a nursing education and practice specialist. And Liz is currently the project lead for the COVID-19 resource development at the National Association of School Nurses. So with that, I'll turn to Lori. Thank you.
Thank you, Julie. Next slide, please. I'd like to let everybody know that we started this work group around COVID-19 and school-based programs back in June of 2020, which for many of us probably feels like a very long time ago, the way this past year has been. And the reason we started that work group was we wanted to address the immediate impact of COVID-19 pandemic on school-based oral health programs. It created an environment where the current methods of providing services needed to be reassessed. The changes actually began in March of 2020, as all of us may recall, and things started closing and schools were a part of that. And they've continued into the spring of 2021. And programs are still contemplating how to navigate revised infection control protocols, prevention protocols, and a multitude of varying back to school models. The Association of State and Territorial Dental Directors formed the COVID-19 school-based programs work group in June of 2020. We had multiple members, as you can see on the slide. We included state dental directors, the School-Based Health Alliance, the National Association of School Nurses, the Organization for Safety, Asepsis, and Prevention. We had 3 questions we were trying to address, and those were, when are schools going to be in session? When will schools be open to outside programs? And what questions will school-based programs need to answer? Next. In June of 2020, the work group came up with a series of questions for an assessment that was then sent out to state and territorial oral health program directors in the 50 states, DC, and the US affiliated territories. The questions asked them to share what their school-based programs plan to do during the COVID-19 pandemic. Next. 43 states and 1 territory responded to the survey in June of 2020. Although at that time, not everyone answered all the questions, the assessment did ask for the respondent to identify which state or territory they represented. However, this information was not included in the final data report. Next. Once we received all the responses, we sent out an email, we meaning ASTDD, to all 43 states and the 1 territory that had responded to the assessment, inviting them to select a time on a schedule between September 8th and September 22nd of 2020 to be interviewed. The interview questions included who school-based programs contacted to request entry into the schools. Was it the state, the district, or a school level? The mode of contact, was it email, letter, phone call? Materials that they had revised, and lessons they had learned. Respondents indicated there were great variability in how school-based programs communicated at the state, the district, and the school levels in the modes of contact chosen and the materials created or revised. But we noticed that 3 common questions came out of the interviews: communication, flexibility, and partnerships. Thank you. Well, back to that. There we go, thank you. Communication covered a variety of things, such as needing to identify the chain of communication within a school district or at the school itself. Some noted this made them realize that they needed a more detailed policy and they need to also be message was, as far as flexibility, that was had changed. Opportunity turned it on to an opportunity rather than focusing on what may have.
Hi, Lori. This is Vu. Sorry to jump in. I think we're just having a little bit of technical difficulty with your sound. It's coming in and out. Can you hear us, Lori?
Slide. I have ourselves here. learn slide.
My apologies, everyone. Thank you for your patience. Gina, if we could go to Tamana's slide, Dr. Tawari's slide for now, and we can go back to Lori when she is able to join back on. And sorry, everyone.
Thank you, Ru. And what I am going to talk about is the impact of COVID-19 on school-based programs. Lori was talking about a survey that was conducted in last June. And then we conducted, the partnership between CareQuest and ASTDD conducted another survey later on in February of 2021. Next slide, please. So the survey aimed to evaluate the impact of COVID-19 on the ability of the state oral health programs to plan and implement the school-based oral health programs, and identified successful strategies and barriers. This survey was sent to all state and territorial dental directors, and we received responses from 37 of the dental directors. Next slide. So one of the first questions we asked was about the challenges faced by the state dental directors in allocation of their time. And what we saw that about 10% of the dental directors, said on an average that they were providing COVID-related support, which was dental related. 6% were providing COVID-19 related support that was not related to oral health, but more or less 84% said that they were doing oral health program and activities as they would do regularly. Next slide. We also asked about if they thought the fundings to the state or state-run or state-funded oral health programs would be threatened. And the good news was that 65% of them said not at all. But 10% of them were sort of iffy about it and said, somewhat is going to be threatened. And 20% they didn't know, so they were not sure. Next slide. So this slide is actually showing us a lot of information. So I'll just walk you through this. We asked the dental directors about the planning and implementation of school-based oral health programs. And so we asked them the same questions, which were for what happened in the fall of 2020, and then what was going to happen in the spring or January to June of 2021. And what you can see is, there are two bars. One, it talks about the planning for the programs to be implemented during the August to December 2020, and then what was actually implemented. And the same is actually true for the Jan to June 2021, the planning phase, and then what is being implemented. So if you see for the fall of 2020, only 10% of the basic screening surveys were planned, and implementation was even less, about 3% or less than 3% were implemented. And if you look at the next phase, which is the the spring of 2021, you see the same sort of planning and implementation. There is a lot being planned. I mean, not a lot being planned, only 8.6% BSS were planned, but the implementation was even less than that. And when we look at the next tab, which shows the school-based dental screening programs, which is other than the BSS, they were able to implement in the fall a little bit more than what they had thought they were planning for. But it seems that the planning and implementation is pretty much close to 8% for the spring of 2021. The school-based sealant programs were planned about, a quarter, 25% were planned and almost 25% were implemented. But what I really want to point out here is the light green tab here, where the lesson or plans or resources on oral health for classroom teachers were planned. And you can see that the classroom teachers actually did a lot more than it was planned. And it was done, a lot of them was done by Zoom, but they went beyond in implementing what the planning was. So next slide, please. So this slide is kind of talking about the reasons, what was the support in restarting the school-based oral health programs. And what you can see here is whether we look at the August to December 2020 or the January to the June 2021, we see that the supportive school administration is sort of on the top, and the state dental directors talked about the fact that they had established long-term relationships with school administration, and they sort of helped in restarting these oral health programs within the schools. Supportive school nurses was the second highest reason that was talked about, and you will hear a little bit more from Liz on this. Supportive funding, and the funding maybe has increased, or they have a little bit more funding for in the spring as compared to what they had in August to December. They did talk about support from the teachers that they got, and also some support in training on capacity building for the school-based programs. Finally, they did also talk a little bit about the support they received from the parent organizations that helped to restart the school-based oral health programs. Next slide. The state and territorial directors also talked about the reasons why some schools did not participate in the oral health programs, and concern for COVID spread was on top, which is understandable. Schools were completely remote. So, if the school is completely remote, there's no kids coming to the school, it would be hard to implement the oral health programs. And then they talked about the readiness of the staff, that maybe the school staff was not ready, or there were state policies that prohibited opening, and so the schools were not able to open. And then sometimes there were district policies that were different maybe than the state policies. So that way some schools were not able to open, and then parents were not ready, or the school-based program staff was not ready to implement those programs, and thus, they weren't implemented. Next slide. So we went ahead and asked them a little bit more on that. What do they think they are planning, or what programs are being planned, at what percentage are they being planned for the 2021-2022 school year? And the percentages are pretty, for the school sealant program, the percentage is pretty close to what it was in the last two, the questions that we asked about the fall and the spring. It's about 25%, but the planning has gone up for the basic screening survey. If you compare it to the previous slides that I showed, it was about 9%, but it has kind of gone up to 16% for the basic screening survey. The fluoride varnish program planning is similar to what we've seen in the past slides, about 15%, and rest all the planning looks pretty much the same as what we saw for the spring semester. We will find out later if they were, able to implement it or not in the coming year. But you can see that 1% of the dental directors here are not planning any of the above because they're not sure how the year is going to look ahead. Next slide. To understand the long-term impact of what COVID is going to have on oral health, we did ask about, will the basic screening survey data be older than 5 years in 2023? And we did get responses from some of the dental directors. If you look at the Head Start, they said that 24% said yes, it will be older than 5 years in 2023. And then if you look at the elementary school, about 36% were saying yes, the dental directors were saying yes, that it will be older. BSS is a tool that provides the state and local authorities with consistent models of measuring oral diseases. So this is a very important data to consider, that if the oral health measurement tool is not going to be implemented and the data is going to be older than 5 years, then it is going to impact how we decide about prevention services and our knowledge about what is the disease level in the children is going to be not correct. So this is a very important impact of COVID-19 that could be seen for many years to come. Next slide. So we asked dental directors that, were they ready to provide any additional support? Were the school-based programs asking them for any additional support? And 65% of them, the dental directors said that they were confident that they could provide the additional resources that the schools were asking. And if you look at the slide here, you can see what kind of resources are being asked by the school-based programs or to the dental directors: PPE, infection prevention training, education materials. But there was some open-ended questions within our survey, and a lot of dental directors wrote in that COVID-19 protocols were something that the school-based programs were really wanting to have so that they could disseminate them to the parents and gain some confidence. Said that how are they going to actually implement these protocols for the safety of the students and still carry on the oral health activities that they do. So this was something that a lot of the dental directors either marked in the survey or put in the open-ended questions that was something they were considering. Next slide. So we also talked about communication with parents and schools. 36% of dental directors reported that they had made some update to the parent consent form. And, it was related to what kind of visit it would be, where would be the visit. We did ask the dental directors about if all the oral health activities that went on between August and December and later on from January onwards, were they inside the building? And most of them said, yes, they were inside the building. About 7% said that they were trying to conduct some of the activities on the school grounds. So they were informing the parents that some of the activities would be done on the grounds. And then, they were providing information related to infection control guidelines, CDC updated guidelines for social distancing, wearing a mask, symptom checks. But about 40% of the dental directors said that communication materials were not yet vetted for cultural appropriateness. And they were considering doing that as they would start distributing those materials. In schools, they got really creative in distributing how they were distributing these materials in a more contact-less format. Next slide. So you can see that they were distributing, paper flyers were still sort of the traditional format was being used still, but they were using text messages. They were posting these on their websites. About 20% of them were doing that. 9% were still doing it in person, but they were also using, social media like Facebook. They had QR codes that they could use for parents to use in a more contactless manners. They also said that, some of the school teachers were giving these materials out through Zoom classes or sending them through email as well. Next slide. So what are the lessons and the next steps that we've learned? One thing that we have learned is COVID-19 has had a huge impact on the oral health program and activities that go on in schools. This response from the survey has shown that school-based oral health programs are not being implemented fully. They're not even close to being implemented fully. There are additional support required to restart the programs that will need additional funding as well. And we need to closely watch the oral health outcomes, and we need to change the policies, improve funding, and provide additional support to these school-based programs to make these oral health programs being implemented to their full capacity. Next slide. There was a lot, several dental directors, did not know, and so about some of the questions that were being asked. So we need to figure out a way to improve reporting at the state level about the planning and implementation of state-funded oral health, school-based oral health programs. And a lot of dental directors provided information to us in the open-ended questions that they needed more funding, or they needed a dedicated personnel to collect the data, to analyze the data, and they didn't have those resources for now, and that's why they were not able to provide that information. They also said that a lot of programs had reallocated people towards vaccine distribution, and that's why they were having a personnel shortage, especially during this time. Increased support for COVID-19 protocols was something that I said before, and it was reiterated a couple times by the dental directors in the survey. And lastly, I just want to say that the pandemic has shown us that, reiterating the importance of oral health is really important. The most supportive reasons for restarting the schools were, the principals, school administrations, and nurses. And we just need to make sure that we talk to them about that oral health is essential and it is required by all the students to be successful in their educational programs. So we just need to make sure that we do reiterate these messages again and again with the people who will be helping us restart the school oral health programs. Thank you.
Well, hello, everyone. I am Liz Clark with the National Association of School Nurses. So nice to be with you today presenting. Oral health and championing oral health is one of my passions, so I'm happy to be presenting today. Next slide. Again, just as a reminder, I'm a nursing education and practice specialist with NASN, and I've been focused on COVID-19 resources for school nurses this past year. I've been with NASN about 2 years, and prior to that, I was a school nurse and school nurse administrator in the lovely state of Colorado for the last 25 years. Next slide. So I just want to really briefly talk to you about the National Association of School Nurses. For those of you who aren't familiar with it, it is the only specialty organization serving school nurses, and it is a nonprofit. The North Star, of course, is the health and education and academic success of students. And our vision is that all students are healthy, safe, and ready to learn. Our mission is to optimize student health and learning by advancing the practice of school nursing. And also note that school nurses impact the health of school staff and families as well, the whole school community. So NASN has a membership of about 18,000 plus members, and it's estimated there are about 95,000 plus school nurses in the country and overseas. And so, it's important that we really promote the relationship between state dental directors and school nurses and school nurse leaders. And so just wanted to let you know that NASN has a 54-member board of directors, including its officers, and that represents 48 states, DC, and school nurses working in American schools overseas. And so connecting with a director is one way that you can connect with school nurses. There also are state school nurse organizations. Each affiliate has a volunteer group of leaders that have reached to their members in their states. And knowing about these organizations in your state would also be important in connecting with school nurses. And 39 states also have a state school nurse consultant. And these are often housed in either the State Department of Education, the State Department of Health, or both. State school nurse consultants can be located on the National Association of State School Nurse Consultant website. And they're very influential in their states. Hopefully, many of you that are state directors, dental directors, know your state school nurse affiliates, and you work with them on other health-related issues. Next slide. So why consider school nurses and state dental directors as partners? The school nurse is a pivotal trusted position within the school community. School nurses are licensed nurses who work in public and private schools and use evidence-based practice to promote individual and population-based student health, provide care coordination, advocate for quality student-centered care, and advance academic success. School nurses are those leaders who bridge healthcare and education and collaborate to create healthy communities. NASN and the American Academy of Pediatrics recommend students have access to, at a minimum, a full-time baccalaureate prepared RN. School nurses are the frontline healthcare providers in schools. The school nurse is the key staff member to assist in implementing oral health programs in schools. On this slide is a graphic representation of the key principles of school nursing practice. Professional practice is guided by this framework. School nurses are aware that our most vulnerable students have not had access to routine primary care, including well child checkups, routine dental care, immunizations, EPSD screenings, EPSDT screenings, and mental health care that is provided in schools. But I'll be honest, there are limitations to this potential partnership. Not all schools or districts have a school nurse. And according to the NASN workforce study that was done in 2016, about 25% of schools did not employ a school nurse. 39% employ a full-time school nurse, and 35% employ a part-time school nurse, which often have 3 to 5 schools each. Many of the school nurses, about 89%, are in public schools and mostly at the elementary school level. The expanded responsibilities placed on school nurses to support schools in the reopening and mitigation of COVID risks have taxed their time and energy. Their responsibilities in general can limit their involvement in partnerships. Addressing unmet healthcare needs, such as oral health care, is central to their role, especially during the back-to-school time, and especially now with the combined impact of students needing to catch up on well child health care visits. A partnership between state oral health care programs and school nurses is a way to share this work, lighten the load, and support each other's goals of keeping students healthy. Next slide, please. So a few words really quickly about NASN's reach, which might be important for sharing resources from state oral health programs to school nurses. NASN has 2 major publications, and we could put articles in either our scholarly journal, the JOSHN, or Journal of School Nursing, or the practice journal, the NASN School Nurse. NASN's social media platforms include Facebook, Twitter, LinkedIn, and we have podcasts and blogs. Our website has over 400,000 unique views each year and offers many resources, professional practice and advocacy resources for members and non-members alike. Our weekly electronic newsletter has a subscriber base of over 60,000 school nurses and school health professionals with a 41.9% open rate, which is very, very high. Online communities are for both members and non-members alike, providing a platform for collegial exchange. There are currently more than 24,000 school nurses and school health users active in these communities. Professional development with C&E, which is important to school nurses, and toolkits are available from the NASN Learning Platform. NASN also has an annual conference, and each state has conferences as well. Next slide, please. Tooth decay is the most common chronic disease of childhood. By the time a child enters kindergarten, more than 4 out of 10 have had tooth decay. Imagine trying to concentrate and learn with serious pain and infections from tooth decay. Approximately 16% of children and adolescents have untreated tooth decay. Ethnic and socioeconomic disparities exist in which 20%, or 1 in 5, of Black, Hispanic race and ethnicities, and 23% among those living below 100% of the federal poverty threshold have untreated dental decay. Based on data from numerous state oral health surveys, the percentage of elementary school children with oral pain or a serious oral infection ranges from 2 to 10% depending on location and population. Next slide, please. So I wanted to share how I became an oral health champion as a school nurse. Early in my school nursing career, I had a student that came in complaining of tooth pain, and I assumed this young man, he was about 8 or 9 years old, had a loose tooth, which school nurses see at least every day in the school setting. And when I took a flashlight and looked in his mouth, he had a huge cavity in his first molar where the tooth should have been. It was just a shell of a tooth. And I said, "Oh, I'm so sorry. I can't help you. I was helpless to do anything." I sent him to a federally qualified health center, a dental provider. It took 3 days for me to get him there, despite phone calls and notes and things to his mom. There were lots of challenges. He was in a very poor title school. 95% of the students were on free and reduced lunch. After that, our district was involved in the basic screening survey in our state, and the reporting came out that 30% of students had untreated dental decay. And after about 8 years in this district, I became the administrator, and I said, we have to do something about this. Why do we watch this dental decay every year and it's not going anywhere? It's just sitting there. So at that time, we implemented a screening program. The district hired a dental hygienist from some school Medicaid dollars, and she came into the district and did screening, oral health education, and also sealants and fluoride treatments. So within 2 years, we saw a reduction in our level of dental decay in our students that were screened on the basic screening. Next slide, please. So that connection between oral health, school nursing, and dental care is so important. And I want to go into a deeper dive on each of these innovative opportunities to support school nurses in the return to school and oral health programming. We're going to talk about each of these. Next slide, please. So there are many avenues to build relationships with your school nurse leaders. And, we talked about, relationships. If you do not have a positive relationship with your state school nurse leaders and dental directors, please reach out. There are many opportunities through the state school nurse affiliate organizations and the state school nurse consultants. The state school nurse affiliate organizations are school nurse volunteers. These people usually have a limited term of 2 to 3 years, and then there's a whole another group of volunteers that come in. So making sure you're continually reaching out and connecting, it's very important to do that. Also offer to present a continuing education offering at a state school nurse conference or meeting. Ask the state school nurse consultant or organizational leader to periodically share data with school nurses through a listserv or statewide meeting. And also you can share innovative ideas from other states or counties on who has been successful and how they implemented oral health programs, particularly during the pandemic. How about flow? How about drive-through screening programs? And you say, who is this flow you're talking about? Next slide, please. So in Alamogordo, New Mexico, Florence Nightingale is known for being a bit cantankerous. She's an older lady, and when she stops working, she often needs some gentle coaxing before she'll start up again. The coronavirus pandemic pushed her to the brink, and working so much overtime depleted her tank, and she spent the holiday break getting some much-needed pampering. Flo, as her friends call her, is a 40-foot Winnebago turned into a mobile nurse's station. She's Alamogordo Public Schools' most lauded healthcare provider, purchased with CARES Act funding that came out during the beginning of the pandemic. Her most frequent passenger, school nurse Lisa Patch, who is also the health services director for the rural school district, which is just 80 miles from the Mexican border. Flo supports many healthcare services brought directly to students, including oral health care. The school district has hired a dental hygienist to provide preventative services to students. Next slide, please. State dental directors and school nurses can share up-to-date oral health resources for students. So this is an infographic that ASTDD created on the key to oral health programming in schools, and Lori had mentioned that on one of her slides as well. This is a tool that's a quick reference to share with school leaders to advocate for oral health programming in your school specific to your state. And if you perhaps have a state map, you can highlight areas that are in great need, which would also support your work. School nurses are always looking for resources for students, free or low cost, such as sliding scale dental work. Are you aware of mobile dental vans that are willing to travel to rural or remote areas within your state? Providing a list of resources or sharing from state or local school websites are extremely beneficial. And I understand that these resources do often change and new programs are often available. Many school nurses provide classroom presentations for Dental Health Month and other times during the school year. Many of you have people that actively participate in these educational opportunities. Do you have resources? Do you have tooth models or extra large toothbrushes that you can loan out or give to school nurses, or perhaps videos or things that you've created during this time? Students living in low socioeconomic areas often lack basic dental supplies. Is there an incentive for students to participate in oral health programming, such as receiving a toothbrush, dental floss, toothpaste, or other educational materials as a benefit as a participation in oral health programs? Next slide, please. With additional COVID-19 recommendations, demonstrate how oral health program components have been updated. If this came out in the survey, it's really important. It'll reduce phone calls from the school nurse to caregivers and to the state dental director with questions about safety of the program. So making sure that when you're sending out those letters or permission slips, the virtual programs, or however you're getting those word out to the families, that you're providing an overview of the program and how safety is addressed with the COVID-19 pandemic. And also with regards to permission slips for the caregivers to sign, if those are required by the district, making sure that those are up to date. State dental directors can partner with school nurses to obtain and disseminate the updated program information. The next slide, please. School nurses working in schools in which students have returned to school have shared they have been working 12 to 16 hours a day, 7 days a week. And school nurses are fatigued and are limited on adding additional programming. However, NASN is hopeful that school nurses will be able to recharge over the summer and perhaps receive additional support through funding through the American Rescue Plan, which specifies funding for school health professionals, including school nurses, to address disparities. The oral health program must be comprehensive and easy to implement. How clear are the how clear are the expectations for the staff involved, internal and external to the school? Are roles and responsibilities clearly defined? How can impact be minimized for the school nurse? Can other staff persons assist with the implementation of this work, such as finding volunteers? What is the best location, internal or external? Can you have a drive-up location? We know many schools have had visitor restrictions this past year, and since most school staff have been vaccinated, this may be different in the fall. I'm aware that some school districts have hired a dental coordinator to support and provide oral health care work in schools. Sometimes a school nurse or school social worker or parent liaison will assist the school nurse with the program implementation. Next slide, please. So innovative ideas. I'm sure many of you have some innovative ideas that you can share. School nurses also have additional ideas that can support them. And these are some things that I thought of. What about starting an oral health screening and prevention program over the summer? We have heard that many schools are going to beef up their summer programming because of the academic loss over the COVID-19 school year. About half of the schools were virtual all year. Some were in and out with, quarantining and testing and other things going on. And so we may have an enhanced summer program opportunity. Have you considered also offering dental screening for fluoride treatment program with other mandated screenings, such as health screenings? Do you have students that are receiving COVID-19 testing? And have you considered partnering oral health with testing? Vaccines, I'm sure you heard, for the Pfizer vaccine for children aged 12 to 15 was approved just yesterday. And so, there'll be maybe vaccine clinics at schools. And would this be another opportunity for students with oral health? Next slide, please. So a couple resources that we have here, the ASTD and NASN had a document that we created, considerations for school nurses and then return to school and dental screening. There's some great information in there to help guide you in the world of COVID. And then also the Oral Health Connection School Nurse Self-Assessment Oral Health Knowledge. This is something that you will be prompted to sign in to complete the assessment. And if you don't have a NASN website or use your account, you can create one that's open to members and non-members. Next slide, please. And this is an important resource for school nurses, the integration of preventative dental resources and school health programs. It's a free course that school nurses can take. If you're not able to have a program in your school, you can learn what you need to do to identify dental problems and actually apply fluoride varnish. Next screen, this is my last one. So I just want to say thank you. This is my contact information. And please feel free to reach out if you need anything. And I know we need to get back to Lori so she can present her slides as well. Thank you.
Thank you, Liz. So we will go back to Lori. Gina, if you can go back to her slides.
Thank you, and my apologies for earlier. I just will start briefly. We've heard part of this for those of you that were on the original portion of this. In June of 2020, ASTDD had convened a work group, and that work group was the one that really came up with the questions that would be sent out to state, territorial, dental directors, and we would get their answers. That would be the initial response you saw in Dr. Tawari's presentation. There was a comparison. That questionnaire, we wanted to identify barriers and find out what was going on with programs. Next, please. So our response rate, from 50 states, the territories in DC, there were 61 potential responses, and we got, go to that next slide, please. Thank you. We had 44 responses. Again, not all states responded to all the questions. Next slide. And when we finished doing that, we took the list of those that had responded and we did personal interviews with them. So they were asked to select a date and a time between September 8th and September 22nd of 2020. And those interviews lasted for approximately an hour. And from those interviews, we found three common themes emerged, and those were communication, flexibility, and partnerships. Next, please. Under communication, there were a variety of things that were needing to be identified within a school district or the school itself. People noted that it made them realize that their school-based oral health program perhaps needed a more detailed policy with the school or the school district, and that they perhaps needed to have contracts in place in order to reestablish their school-based program. When essential workers were allowed back on campus, it was also unclear who was considered an essential worker, and that was challenging for these school-based programs. And as many of us have seen during the pandemic, it was very important to have a clear and consistent message. Flexibility was another one. In my previous life as a surveillance coordinator, I used to show Gumby on there as, the need to be flexible. So many things have changed because of the pandemic. Many programs noted, though, that it was an opportunity to reassess their program protocols and priorities, as well as a way to explore alternate ways to provide services. So what they actually did was turn this into an opportunity rather than focusing on what they had lost. For them, the glass was half full. And partnerships. It's perfect that this is following Liz's presentation. That I heard that constantly from everybody when we were doing the interviews. Most could not stress enough how valuable their relationship is with their school nurse. It also made programs realize, though, that not all their partners had the same capacity to assist them as they had previously. It depended on the partners, whether they were a large or a small organization. And several programs also looked at it as an opportunity to explore new partnerships, such as with their immunization program, as you also heard Liz mention as an innovative idea. Next. CareQuest reached out to ASTDD last fall and wanted to know about partnering and co-branding with us. So we actually, some of you may have participated on our webinar that we had the end of last year. We also created an issue brief and the infographic that are available on our website as well as CareQuest website. And they also wanted to be part of this follow-up assessment that was done earlier in 2021. And we were happy to join in the partnership with them. And the final results you were seeing with Dr. Tawari, the comparison of the two. Next. The second assessment went out in early March 2021, which was approximately 9 months after the initial one. So ironically, that's about a school year's worth of time, although that was over the summer. And as we saw in the initial assessment, we did not get all states or territories to respond to all the questions. They'd respond to some, but not necessarily every single question. Next. So the intent of the assessment was to identify the barriers that school-based oral health programs were running into and evaluate the impact of COVID-19 on the programs. We also wanted to identify which programs had successfully implemented a plan for returning to provide services at the school and to identify what services they would be providing when they returned. And that you might have noticed that Dr. Tawari also mentioned those. Next, please. So an invitation went out. We were partnering, when I say we, ASTDD was partnering with CareQuest. And since we had Liz Clark participating on that original COVID-19 work group, we reached out, we had been working with the National Association of School Nurses, NASN. And so we wanted them to be part of this webinar because we realized how important it is to have that relationship with the school nurses. And as you could see, there were a lot of important partnerships there. And I think Liz did a great job of giving us ideas as to how those of us that are working with school-based oral health programs can work with our school nurses as well. Next. And finally, many programs mentioned they had a need for resources. That might be consent forms, protocols, guidelines, etc. And so ASTDD has many of those examples available on our school and adolescent oral health webpage. If you go down to item number 3, we have a list of resources that have been shared by various states, and they're categorized by different activities, such as activities for school-based programs, examples of communication and messaging, consent forms, guidelines for providing services, their letters and emails that they shared with their different levels of state administration or school nurses. And then there's also a section that talks about teledentistry, legislation and advocacy. And I'd reach out to all of you if you have items that you've developed because of COVID-19, please share those with me and we will post them to the page because it's that age-old thing of why reinvent the wheel. And one thing we've all discovered, I think, during COVID-19, nothing is static. Everything's changing. And I guess the only thing I can say is we're all learning that change is our new normal. So thank you. And I believe now we'll be open for questions.
Thank you, Lori. So before we go to the questions, I just wanted to say thank you to all of the speakers for a great presentation. I also want to let everyone know that the content from this webinar is part of our online report, which will also be emailed to you after the webinar takes place. So that's showing on screen is the front cover of the report. I also want to remind you all that you can always visit our website at carequest.org to access past webinar recordings and upcoming webinars to earn CE credits as well. We also have a wealth of other online learning modules and various resources available to you. So Gina will send the webinar evaluation form via email on Friday. And again, it must be completed next Friday, May 21st. And if you are looking to receive continuing education nursing credits, please visit the NASN website. Our next webinar will be on continuation of our series of the wicked problem of the oral health care system around payment transformation. It will be scheduled for May 27th. So please be on the lookout for the registration. Gina, if you go to the next slide as well. And here are just a few ways for you guys can stay connected with us. You can follow us on LinkedIn, Instagram, Facebook, and Twitter. And you can find the links in the webinar slides too after the webinar takes place. So I know our webinar is scheduled until 1 p.m. But if you would like to stay on for a little bit, we want to have a chance to do a Q&A session. So we will extend the webinar to 1:15. But again, we want to be mindful of your time. And we will have the recording available on our website as well. So you could listen to that after. And so now I'll hand it off to Dr. Julie Hawley to get us started with the Q&A.
Thanks, Vu, and thanks everybody for your flexibility. You know, I think one thing we've all learned with the pandemic is what Lori said about being flexible and kind of going with the flow. So, well, we do have a number of questions, and I first want to acknowledge a lot of the comments in support of school nurse programs and trying to engage a little bit more with oral health. So we have a couple questions in the same theme. This one is, do state dental directors work with state education directors and state nursing organizations to implement and support school-based oral health programs to establish more consistency across our country? And then there was an early question that kind of addressed the same thing. So any comments or suggestions about consistency across the country?
Well, I'll go ahead and take that. I can share, and for those of you that have worked around state oral health programs, when you've seen one state oral health program, you've seen one state oral health program. They are not all the same. And so some programs interact more with their Department of Education than others. Some states, their sealant programs, I don't know why my video keeps going out, my apologies. But some states, their sealant, school-based sealant programs may not be necessarily affiliated with their state oral health program. Some are, some aren't. So, you know, that impacts that as well. But of course, I know at one point in time when I was in that role, I worked very closely with the Department of Education, and I was always reaching out to nurses. So, you know, I think that's a great relationship to develop, and certainly an important one.
Great, Lori. And there's a question that actually I'm going to answer. And it is there an update on when OSAP infection control guidance for schools is coming out? So there was an update from the CDC on infection control for school-based oral health programs that came out a few months ago. And so I've asked Vu to kind of put a link to that. CareQuest did work with OSAP to update our best practices guidance for providing care during the pandemic. And that was updated to include some information regarding school programs. So Vu, if you're able to find that and put that in the link, we can share that with folks. So let's see, another question, and this one is, I would like to hear your views on the role of school nurse in assessing perinatal oral health for pregnant teens in school. Perinatal oral health is significant for the health of pregnant women and oral health of their children. So Liz, do you have any ideas or comments on that?
Sure. I mean, you know, school nurses from just basic nursing training certainly can get a flashlight and look at teeth and see if anything looks unusual and make referrals. That course that I had in my slides is an excellent course to expand those resources. You know, also, you know, working with a dental hygienist or community provider is something, you know, that can be helpful. I know some school nurses have had limitations on visitors, and so that's why we wanted to provide that information of having the school nurse having some of those assessment skills beyond just the basic skills. But yeah, that's an important question. And I think, especially in rural and frontier areas where there may not be a health provider or long travel for oral health care services. So I hope that answers the question.
Thanks, Liz. And another question for you, is the NASN providing oral health education at NSAN conferences and via internal discussion? So you touched on that a little bit, but what other resources might be available?
Yeah, there's also some resources on the NASN webpage under oral health, and the things that I shared that are on the NASN Learning Center that nurses can get CEU for and training. So it is important, and we do have presentations at the annual conference every year for oral health, and work with our national partners in supporting the health of the whole child, including dental health.
Okay, great. And Dr. Torrey, a question for you: with the sport of restarting oral health programs, was the impact of public health included in the survey?
Yeah, I did write some answers over there. But
Okay.
I didn't have a direct public health question, although we did ask questions about, how were these programs targeted towards ethnic minority students, and we got some responses from that from the dental directors. The details of that are included in the report. 21%, of the dental directors responded and gave us the breakdown of the ethnic minority students in the schools and how it was targeted towards them. We also asked some Medicaid eligibility questions about the school students, and saw that the Medicaid eligibility went up, but the utilization was not that up. So we did get to some public health questions, but there was not a direct question in the survey about public health.
Okay, thanks, Tamana. And I have another question. I don't know if it's for Tamana or for Lori. It was early on in the presentation. I'm not sure what slide it was, but it says, are these statistics 4 out of 10, 16% US deaths?
I think that was for Liz. I saw that question pop up during.
Okay.
Yep, that was from.
Or was it Liz? Okay, sorry about that.
Yeah, that was from the CDC. So that was from the US.
Okay. Okay. And then another question about virtual screening. Any experience in virtual screening in school settings? Does anybody have any experience with that and any insights?
For the survey, from the survey, what we saw, especially in the open-ended questions, they weren't talking about virtual screenings, but they were talking that the school nurses and the school dental hygienists were in contact with parents and were sort of helping triage the students if there were any emergencies or anything. But we didn't get a response to any virtual screenings per se in the survey. But Lori may have more knowledge about this.
I have not heard. I know there were a couple of states that were exploring the potential for teledentistry, having screenings that way. But of course, that is dependent on practice acts. And, so right now, I think you're going to see more happening around that. I think what happened with COVID made people more aware that we need to, as Liz said, be more innovative. We need to look at how we might address these situations. So stay tuned. I think you'll hear more about teledentistry.
Liz, do you know of any virtual care being provided in school settings that are not necessarily related to oral health, but could provide us some learnings and a good example?
Absolutely. I know school nurses have expanded their role this last year into virtual school nursing. And so they have been connecting with students and families, through their computers and addressing unmet health needs, including oral health. And so, if a child had dental pain, they could have the student, open their mouth and best they can from their computer or laptop or whatever sort of device they had, and then make, a community referral. So, it's more of that community connection and getting, students to places that they need. in regards to, instead of a screening. And certainly a screening could be done. It'd be interesting to see how that could be expanded. Absolutely.
Okay. And then this is a great insightful one. And this is, how do we engage with school nurses in oral health programs without overwhelming them? I can imagine only how their hands might be full as schools reopen. So I think that that's really important for us to understand that there might be a lot of competing priorities, and how do we best engage in that?
Yeah, that's a great question. And I think, because of the importance of oral health in schools, that school nurses in general, are very open to that. If there has been programming in the past that they've missed this year, they'll be anxious to get that going. So I would say connect before the year goes out, whatever timeline your state and school system has, that does vary across the country. Some are done in May and some are, done later in June. And then maybe, reconnecting, over the summer. And it may take 2 or 3 times, to get that response, but to say, I'm here for you. I understand there's a lot going on. Here's what, we're planning or like to do, or when can we meet, and just sort of, being that nudge, because sometimes that's important too. We're all hoping things are going to get back to some sort of new normal soon, and we'll be able to do all the things and more that we've done in the past. And so I would say, being persistent, giving the school nurses some space, but yeah, getting those messages out soon, and continuing to do that until, we can get things in place for next school year.
Thanks, Liz. Lori, I'm going to ask you a question next. Any advice on getting all the different programs to coordinate their efforts? We have country and state level programs that seem not to always communicate efficiently.
Well, the coordination is, it is a challenge. And as I said, not all programs are directly tied to the state oral health program. So I think it's certainly worth the effort, particularly around the data piece. But I think you need to have, I'm sorry, I don't know why this keeps happening. I do think it's important that somebody be identified as the person to coordinate and maybe have calls or meetings of some sort to coordinate. I think that having one person that's the key contact would be helpful.
Okay, great. Tamana, I'm turning to you. The data, I think this is you actually. I think this is you. In the data where it showed that 25% of school-based CMUP programs were planned and implemented, do we know if it was driven by certain states, or was it spread out in all the states? And in all the states, about 25% of schools were successful in implementing the school-based CMUP programs.
25% were successful in implementing. So when we asked the question, if you look at the slide, or you look at the diagram in the report, we first asked about planning, and then we asked about implementation. So there might be a different number for planning as compared to the implementation, because they were being planned more than they were being implemented in most cases. And this report is an aggregate. So 37 dental directors responded. So if we are saying, 25%, that was, 25% of the dental directors said that they were implementing or planning those activities were being planned or implemented.
Okay. I'm going to turn to one that we started with, but there's another question on this. How do we get a federal mandate for oral health screenings through Washington, D.C., like hearing and vision? And then a related question, does NASN have lobbyists? I don't know who wants to answer that.
Well, I can start.
It's clearly you, Liz. Yeah.
Since NASN was mentioned, NASN does have a lobbyist, and the vision and hearing are actually state mandates. They're not federal mandates. So each state decides what mandated screenings to do in every year. So it would be a state level, although certainly national recognition by organizations such as ours that are here today would certainly help. I think the current administration is certainly seemingly open to improving the health and welfare of vulnerable populations. And so I think that this is an opportunity now to sort of bring up some of those concerns and to coordinate and try and provide additional resources. Oftentimes it comes down to funding, right? And having adequate resources. I think that came out somewhat in the survey. So, that's my 2 cents. I think, it's important, but it is a state level mandate, not federal.
Lori, any insights from you?
There are
Kamana?
states that do have screenings prior to kindergarten. It's a hard sell, as so many things are. It might be, if states are looking to do that it would certainly be helpful to reach out to your school nurse association, the school, your Department of Ed representative, and, build that relationship and look at partnering for that legislation. Again, though, I would definitely include your nurses before you do that, because they probably have some insight into how that would work, since they're already doing the screenings, how those might work, how the oral health screening might fit with the hearing and vision.
Okay. Another question just popped up. Why is there no focus on the use of silver diamine fluoride in school-based programs?
Actually, there was, the question was asked in the survey, whether silver diamine fluoride activities were planned or implemented. And I think the percentage was pretty low, about 4% of these activities were planned and similarly implemented. You can see that, but we did ask that question. Not a lot of dental directors were using this. I mean, were using this in their school-based programs.
Yeah. So a comment just popped up. The STDD website is currently unavailable. Will that be up soon? Lori, I'm assuming you don't know what's going on with that, but just to share with everybody that the report is almost finished, and we'll send a link, as we mentioned, to participants via email. So I'm kind of sometimes we got 2 more minutes, and we said we'd go extra 15 minutes. So one question and one comment. So a question was, have you requested the Dental Society for fixed dental chair in school? And in the chat, there was a comment, if school districts hire certified school dental hygienists, the burden of overseeing the oral health of students can be alleviated. So I think the concept here is to bring dentistry into the school with a dentist or a hygienist available. Any thoughts from the panelists on that?
Well, my guess is some of that would be related to the funding issue. That's always the dollars count. So I think that schools would probably be open to the idea. It's a matter of getting the financial support to do that, and starting with partnering again with the Department of Education, your school nurses, your dental society, your dental hygiene association, those types of things, getting everybody in on it so that everybody's advocating for it.
Yeah,
and Liz, from the nursing perspective, yeah, thank you.
Yep, I just wanted to share that, yeah, absolutely. And I know, many states use school Medicaid dollars or partner with a school-based health center or federally qualified health center, or local dental nonprofit, community nonprofit, to have those services in schools, including, donations of dental equipment, dental chairs, and volunteers to do the work as well. So it's complicated, right? But, if there's passionate people, it can be done. So finding those champions to work together to get those resources. I know mobile things also work, so.
So with that, it's 12:15. I want to thank the 255 people who stayed on after 15 minutes to engage in this Q&A. And thanks to everybody for your flexibility in dealing with the technical challenges. Again, the panel, you all did a wonderful job, so thank you.
Thank you.
Thank you.